Hello, my name is Dominic Cancilla, and I will be doing my report on a 43-year-old female admitted on the 5th for opiate dependence and withdrawal. Patient reports that she had pretty serious MRSA in 2004 when she was about 29 years old. At that time, she was having such bad full body pain that she got prescription for opiates. Um, she reports currently that I just want to control the pain. I just want to not hurt. She also reports that it was never about getting high for her. She also stated that I did not get myself addicted to pills, the doctors did. Now, partially, there may be some truth to that, but it also points towards not having accountability for what she's going through as far as addiction. We had conversation about her body not knowing the difference between who prescribed this to her versus if she's getting it off the street, which she now indeed is getting it off the street. Um, Patient reports that she was taking fentanyl, snorting it, and she only started that about a month ago. She's using about $50 that would last her 3 days. Um, She was also utilizing Vicodin, 5 to 6 of them per day since she got her prescription back in 2004. Most recently, she went through about 20 tabs of the 300 milligram tablets. Her last use was on the 5th. Patient also reports THC use, smoking about 2 to 3 joints per day since she was 18. She also reports tobacco use of about a half a pack per day. Um, Patient stated that she may want to be started on Suboxone. This may also help treat the pain that she's experiencing, but she's never tried this before. I will talk about this more later, but she reported swallowing the Vicodin, so this may have an impact on the treatment of when to start Suboxone. Again, I'll touch on that in a little bit. Patient reports never using Narcan, but she does have it. She reports trying to stop several times. Reports self-detoxing at home if she knows that she's going to run low. She'll start to titrate down the amount of pills that she takes each day so she doesn't go through withdrawal. She said she did experience withdrawal in the past a few times, and this time she brought herself self-admit into the detox unit. She has a treatment history at Harbor, also family services in Northwest Ohio. The patient has a medical history of fibromyalgia, arthritis, and then the history of the MRSA. She also has a mental health history of bipolar and anxiety. Patient has allergies to morphine, vancomycin, Wellbutrin. Her mother also reports a history, or she reports her mother has a history of bipolar. Her mother, grandma, and aunt are all alcoholics. Patients currently experiencing numerous withdrawal symptoms, including fatigue, chills, hot flashes, cold sweats, insomnia, goosebumps, runny nose, muscle aches, cramps. She reported current anxiety and depression as well. Um, Going forward, so I gave her a score of 50, serious impairment in occupational functioning. Possible etiological factors are family history of bipolar and family history of addiction. Going forward, we're most likely going to be starting her on Suboxone to help treat her addiction and also her pain. And with her in particular, it is important to consider that she is swallowing the pills, because when someone is swallowing the pills, it affects the half life, it makes it longer, and could cause withdrawal symptoms to set in later than they would normally, with snorting or injecting. It is important to wait for cow scores to be higher than they normally would to consider starting Suboxone. Like I've talked about before, you don't want to start Suboxone too early because it could precipitate withdrawal and knocking off the opiates off of the receptors and make symptoms a lot worse. So you want to make sure that she's going through withdrawal. Also, very important is the objective observation of withdrawal symptoms. So when she's starting to, the symptoms she currently reported are very mild. And that she was endorsing a lot of them, but my objective observation was that these symptoms were very mild. Going forward, that is very important to consider prior to starting Suboxone. And that is my report on my patient. Let me know if you have any questions. Thank you.